How are you, doctor?
I'm well, and yourself, my Lucy?
Doctor, I just want to interview you here. We heard a lot about you, are incredible. So I need to ask you some questions. So firstly, what's your name?
My name is Nkuli Boikhutso.
And what do you do?
I'm the CEO of the hospital.
What kind of hospital?
Of the children's hospital. I'm a doctor, and I take care of the hospital.
And do you like your business partners?
My business, the people I love of everybody that I work with. They're very nice.
Okay. What do you do?
So my job is to make sure that everybody has everything they need to work in the hospital. So everybody who's sick, the kids who are sick, they must be taken care of. So that's my job every day.
Okay, and since you've been working here, how was it?
Yo, it's nice working here. You meet wonderful people, children, mommies, daddies, different people, and people who support the hospital, donors and friends of the hospital. It's very nice.
Is it not busy?
It's busy. Yo, the kids keep us very, very busy, but we want more kids to come and to be more and more busy, but it's very busy.
I think that's all for today.
That's all.
For today. Welcome.
I have the privilege of leading a children's hospital in Johannesburg. That is Melusi Sibanyoni. He's one of our patients. When that interview was done, it was on one of his good days. And he has quite a few of those. But of course, he also has some challenging and difficult days that are typical of children who are living with chronic illness. Melusi has spent many days, in fact, many months, with us at the hospital, separated from his family. And that's because the hospital is far from his home. I remember his mom once told me that they have to wake up at 2 in the morning to make sure that she gets her young one ready and gets Melusi ready so that they can make it to Johannesburg on time for him to start his dialysis session at 7:30 in the morning. As you can imagine, this is difficult for this family. Melusi's on dialysis 4 hours a day, 3 times a week, for an indefinite period, well, at least until he gets a kidney. So this is costly and just unaffordable for a family like Melusi's family, a family that has limited means. And amidst all of this, Melusi still has to get some form of education. So I first met Melusi about 6 years ago. He was short of his 7th birthday. He was 6 years old. In fact, he was one of our patients when we started the hospital. He had been referred from Mpumalanga province, where the care for the type of condition that he has is just not available. So our hospital was built with kids like Melusi in mind. We receive patients not just from within South Africa, but in fact from across the continent. We have referrals from as far as Kenya, Angola, Mozambique, Eswatini, Botswana. In fact, 14% of the referrals from the hospital are from outside the country. We have kept the promise, which is to provide care for children regardless of the socio-economic standing of the family or their ability to pay. And this hospital was born out of Mr. Mandela's vision to change the way in which society treats its children and young people.
Only 3 children's hospitals serve this continent, with its population of 741 million. This is not enough. Children of Southern Africa, too, have a right to be cared for and to receive the best medical treatment available when they are ill, and to receive treatment that compares with the best in the world. The Children's Hospital will be a credible demonstration of the commitment of African leaders to place the rights of children at the forefront. Nothing less would be enough.
It took ordinary South Africans, business, government, and the global community working collectively to make sure that this dream is realized. Mr. Mandela is not around to see the hospital, but we have kept that promise. And this collaboration with government ensures that we continue to sustain the hospital and provide specialist care. So currently in South Africa, the care, availability, and quality is highly determined on your socioeconomic status and not really about the level of care that you require. South Africa does remain, unfortunately, an unequal society with a Gini coefficient of 0.63, reportedly the highest in the world. There's a figure that's mentioned a lot in the healthcare space that 80% of South Africans rely on the public health system for care. And why is that the case? We know we still have economic inequality, as evidenced by high levels of poverty and an unemployment rate that's sitting at 32.9%, according to Stats SA. There's also geographic inequality. There's a difference between rural and urban communities in terms of facilities and infrastructure that is available to them. There's definitely a difference between developing and developed countries. And this was evident during the COVID pandemic and access to COVID vaccines. There's racial inequality, which is rooted in previous discrimination that existed, that was systemic in our country. So at the age of 15, I was diagnosed with cancer. Research shows that because I was born in South Africa, my chance of survival was 50%. Because I was a black child born in South Africa, that rate of survival drops to 46%. If I had been malnourished, like a significant portion of South African children are, my rate would have even been lower. And this is compared to 80 to 90% survival rates that you see in developing countries. We continue to see gender inequality. In fact, the World Economic Forum reported that less than 1% of healthcare research goes towards diseases that affect women. And as we know, gender is also a predictor of economic opportunities. Now back to Melusi.
Hi, my name is Melusi. My surname is Sibanyoni. And guys, I'm here in Mandela Children's Hospital waiting for a donor, kidney donor. My blood type is B+. So guys, can you please support me? I'll be much better with it. Thank you.
So unpublished data show that less than 10% of children who have chronic kidney disease, like Melusi, are able to access care and access it on time so that they have good health outcomes. And that's why it's important to have hospitals like the Nelson Mandela Children's Hospital. If Melusi had been born in a developed country, he would have had that kidney by now. He would have had a hospital that can care for him that's closer to home so that he doesn't have to travel 3 hours each way to get to hospital. He would have most likely been back in school and continued with his education. And definitely, he would have not had to witness many of his friends pass away from chronic kidney disease because they too find themselves in similar socioeconomic circumstances. But all hope is not lost. South Africa has made significant changes, systemic changes and reforms in the healthcare space. I remember when I was a junior doctor back in 2006, at the height of the HIV pandemic, I used to witness young children, young people, older people passing away from HIV. But fast forward to 2024, South Africa has the largest HIV treatment program in the world. And that's because of civil society action. It shows that empowered communities can make a difference. We are a hospital in Johannesburg one hospital in Johannesburg. Our facilities are world class. The care that is provided by our specialist doctors and nurses and the interprofessional team are on par with the best in the world. But we are just one hospital in Johannesburg, and more programs and facilities like ours are required if we are to change the status quo. Our hospital has become a place of hope and healing for our children. It's become a sanctuary for them. This is Anthony Shabalala.
I like to tell people about this hospital. They must learn something. This hospital, man, is good, man. It's good. Even the doctors are good. Patients are good, respecting, and we're all respecting, né? Even these sisters are respecting us. So we're all respecting them.
Are you getting better?
Yes, I'm getting better. You see, this my God will respond to me. I will get a key too. By the end of February, I will get a key.
This is Anthony, Melusi's best friend. They're as thick as thieves. On the 28th of March this year, unfortunately, Anthony lost his battle to chronic kidney disease. Despite everything we did for him in providing him with dialysis, there are certain things we just couldn't change. His socioeconomic circumstances and the fact that there's a shortage of organ donors in South Africa. A child needs to receive a kidney 18 months after diagnosis for them to have a chance at a better life and be healthy, productive members of society. Health is indeed the great equalizer, and it's absolutely foundational for us to be able to achieve any of the SDGs that we want to achieve. Nelson Mandela once said that giving children a healthy start in life, no matter where they're born or the circumstances of their birth, is our moral obligation.
Sharp. Bobi kunzima sithanda sangithi bakobe ndibuyele ekhaya kobe kuhlulekile bazale bami. Okay, sharp. It's in.
That was Anthony saying he's going home. It's difficult. We need hospitals. We need a Nelson Mandela Children's Hospital in Angola, in Mozambique, in Eswatini, in Botswana. We needed a children's hospital in Limpopo, where Anthony comes from. We need a children's hospital in Mpumalanga, where Melusi lives. Thank you.